Okay, hi, it's Dr. Buford. We're just getting started on the right knee. We're looking in the medial compartment here. We've already harvested the bone marrow from the posterior iliac crest, and that looks good. This is this meniscal problem you've got here. In the anterior horn, it looks great, way up here, but starting right there, you can see this problem. You've got this little bridging portion of meniscus with a hole behind it. And then as I straighten the knee a little bit, this whole posterior horn is not normal as we get a clear picture. So this, as you can imagine, is not a repairable thing. You can see there's just no tissue there to repair. And that's probably why all of the other things you've tried so far haven't really been successful, because you've got this meniscus that just structurally is not really intact anymore. So we're going to start right here. And now we're going to continue to use our shaver just to take out the loose pieces as we create them. You can see that there. The shaver has suction attached to it. So our whole goal at this point is to get back to a stable rim. You can already see that bridge is gone, so that won't create any more problems, hopefully. And then we've got some more work to do here in the posterior horn. Okay, so I think we're getting close to being done on the medial side. I can feel that we're back at the rim. We're going to go ahead and take our shaver one more time. And that's already looking a lot better, isn't it? So table down just a little bit, please. Awesome, thanks. Okay, so I think we're just finishing up here. I'm going to irrigate with some normal saline. And now this medial compartment sure looks a lot better to me. Nice, especially if we add our orthobiologic injection here. I think that'll be the best we can do to try and get you some long-term relief here and try and stabilize the joint as best we can. Okay, we're going to pause on the video for a minute. Okay, so here's your anterior cruciate ligament. It looks great. No signs of any laxity there. We can use our shaver kind of as a probe, and that ACL looks awesome. We're going to look in the lateral compartment next. Okay, so we're looking in the lateral side. Luckily, there's not a lot to do here. So a little bit of wear and tear changes on the condyle. You can see some fissuring in the cartilage down below. But for the most part, this meniscus is in much better shape. There's just some minimal tearing, but when we turn on our suction, you can see that meniscus is stable. It's not getting pulled into the joint space at all. So I'm happy with that. We're going to look at the patellofemoral joint next. That's your patella at the top of the screen there. And just like the other areas, we're going to irrigate first and then try and take a look. So you do have some wear and tear changes on the undersurface of the patella. You can see this medial facet has some softening. The trochlea here, as we track down the front of the knee, this looks pretty good. But as you come up here, we can see that the patella is the area that has probably the most wear and tear change right here. So again, I don't see anything super loose hanging down. We're just doing kind of a mechanical debridement just to make sure there's nothing loose. You can see the inflammation in the fat pad and in the synovial tissues. Most of that I think will be sorted out when we do our orthobiologic injection, which is a very anti-inflammatory injection. But in terms of the debridement of the surfaces, I think we're just about done. We'll look over here in the medial and lateral gutters in just a minute. But I think this will be the end of the video, okay? So good luck to you now. Bye-bye.